I'm Dr. Easton Kelsey and I heal my eyes naturally. This is part 2 of a dry eye discussion. What is dry eye? Dry eye is also known as ocular surface disease because there's an imbalance of one or more of your tear layers. The 3 layers are the outermost layer is oil, which keeps the water from evaporating, which is the second and largest layer. And the third layer up against our eye is mucus. Most people have problems with the oil or the water. So what do most people do about that? Well, they try different drops. Well, I'm here to tell you not all drops are created equal. I would never use Visine, Clear Eyes, Murine, Rhodo, and the main reason is they all have toxic preservatives in them. There's a lot of good drops in the market, but the drop that I like the best, and it's included in my 2020 Vision Regimen bundle, is Systane Complete. See how shiny that is? And this one is PF on a box. That means that it's preservative free. This is the #1 drop recommended by doctors. Why? Well, number one, most drops only have the water and the mucus in their tear formulation. This one has all 3. It has the oil. That's why it's #1 recommended. See, it says right there. Also, it has nano droplet technology. What does that mean? That means they formulated this to stay on your eye longer than the average drop. One drop on average stays on the eye 8 hours. So what I usually tell people to do is get the twin pack, leave 1 pack on their nightstand for before bed and in the morning, and 1 with them on the go that they can do during the day. That's all you need. But let's go into some of the other reasons for dry eye. Did you know that medications can have an effect on your dry eye? If you have allergies, especially chronic allergies, and you're taking antihistamines, that can induce dry eye. Also, birth control. There's a lot of other medications that can cause that, including antidepressants. So you might want to just check the side effects of your medications to see. But what I really want to talk to you about right now is hydration. There's nothing that you have more in your body than water. In fact, if you took all the water out of your body, you'd fit the thimble. And if you're a woman, we would call you Thumbelina. Water is so important. And most of my patients when they have dry eye, I ask them, how much water do you drink a day? And they say, not enough, sheepishly. So what's the recommended amount of water per day? Take your body weight, pounds, divide by 2, and that's how many ounces that you should have. Now, if you're doing things like exercise, or do you consume alcohol or caffeine, that may negate some of the hydration. You might need to have more. But here's the other thing that's really important. Electrolytes. If you don't have the electrolytes, then the water is going to pass right through you and you're just going to pee a lot. So electrolytes are so important. Those are a few of my favorites. Relight by Redmond's. They make the best salt in the world, real salt. Also, Liquid IV sugar-free. They've got a lot of great flavors. Go check it out. But I had dry eye before I started my regimen, and now I don't. So if you want to have a permanent fix to your dry eye issue, consider the 2020 Vision Regimen. Blessings. Namaste.